Today. Do you have a bleeding disorder and find yourself struggling to stay consistent? Well, I've got good news for you. We are going to be talking about exactly that at an upcoming educational online live event that we're holding very soon here on May 22nd and 23rd. And I'd love for you to come hang out with me and join me, talk with other people in the bleeding disorder to learn more about how to stay consistent. I always say that you can have the best medication in the world, but if you don't have access to it, or if you don't take it regularly, you're not going to receive the benefits from that. And so we want to encourage you to stay consistent. And this is one of the reasons why we love doing this event. So I'm really excited about a lot of the great sessions that we have planned for you. We have a lot of different content to talk a lot about how to be empowered, both for men and women, people living with mild, people living with severe. It doesn't matter what your diagnosis is, hemophilia, von Willebrand's disease, all of these different types of bleeding disorders are really important to stay on a consistent treatment regimen preventatively. So really excited to talk about that. And one of our speakers who you probably know and love just as much as I do is my good friend, Dr. Claudio Sandoval. And I've invited him to join me today on this podcast. Dr. Claudio, it is great to see you. Thanks so much for joining me today.
Absolutely. Good morning. And you know that the feeling is mutual. And I've told you this before. I think, working with you and Hope has really just been such a breath of fresh air for me, a highlight of my career. And I think that, you and I kind of think alike, that we don't always have to agree, we each have a good point of view. We come from different circumstances, but you know what? Boy, do we have a good time. And I think our goal really is to just to educate as many folks as possible,
So true.
and try to help out as many folks as possible.
Well, it's like that old saying, what is it? Knowledge is power, right? There is a certain aspect to what we do that is I'm constantly trying to push the envelope to, teach myself more, to learn more. That's why I love hanging out with you. And I always learn something new, but I always think that too, so much about the people in the community that we rub shoulders with. You're only going to be as successful as the knowledge that you understand and utilize. And so that's one of the things I'm super excited about this conference coming up. But for those folks that may not have heard you speak before, don't know your background, if you could just tell us a little bit about where you're from and what you do with Octapharma.
Sure. So just to add something about the knowledge, I mean, I agree with you, but we also want to make sure that folks are getting the correct knowledge. That's why when we give presentations, Jonathan, you and I, we give unbiased, from the heart presentations, so that then folks can take that home and say, hey, you know what, I learned this. If they want to confirm what they've learned, they can always do so. But we're here to kind of just make sure that folks have that knowledge so that they can help themselves, help their loved ones, blah, blah, blah. So about me. So I'm a pediatric hematologist oncologist. I've been one for coming now 34 years. I left academic practice in 2019. I now am employed by Octapharma. I'm a senior director of medical affairs here in the hematology division. And I just love talking to folks, learning about them. In medicine, history gives you 90% of your diagnosis. And what I mean by history is not only talking, but listening, not hearing, actually listening to what the person is telling you, because that person is telling you what's wrong with them. You just have to be able to pick up exactly what they're going to say in their language. So like a baby talks in a different language than a teenager, than an adult. So we train ourselves to pick up on these clues so that we can help folks. But that only comes from listening.
Yeah, that's so good. I think so often I've seen some memes online recently, and you've heard the same before, I'm sure, of just that so often the problem with society today is that we listen to respond instead of listening to understand. And I do think that how important it is for us to try to expose ourselves to like you said, the right information, because time is limited. And so you can be with the best experts. I often think about, if I was going to go sit and have lunch with Warren Buffett someday, what would be the questions that I would ask him, and guarantee you that I might pick up one or two tips that would be valuable to me. But at the end of the day, there's no possible way that I could ask him everything that I want to know, even in that lunch, or I couldn't I couldn't learn everything from him in just an hour or so over lunch. And so, it's important that we continuously learn and expose ourselves to this learning. And so I'm really excited about that. This conference we have coming up on May 22nd, 23rd, you're going to be doing two specific topics that I'm really excited about, one on iron deficiency and another one on prophylaxis. But tell us a little bit about what are you excited about these sessions, and what are you hopeful to accomplish?
Sure. So to kind of just to talk about prophylaxis. So we have a very well established kind of prophylaxis for males with severe hemophilia. But there are different types of hemophilia out there, Jonathan. You know this as well as I do. There are folks with moderate, there are folks with mild, there are folks who are males, there are folks who are females, and perhaps the treatment paradigm that we've established very well for males with severe hemophilia just may not be good for folks who have moderate or mild hemophilia. So, for instance, you may have a woman with hemophilia who has heavy menstrual bleeding. Well, she really doesn't need to have factor 2 to 3 times a week. What she really needs to have is to have factor during her menses. If you have a boy with mild hemophilia who's having joint bleeds, well, maybe he has a different type of mild hemophilia, and maybe he should be treated more like a boy with severe hemophilia. If we have a boy with moderate hemophilia or mild hemophilia, or a girl with moderate or mild hemophilia who wants to participate in sports, when they're not actively participating in sports, they're not really having any bleeds at all. But when they're participating in baseball, tennis, lacrosse, perhaps they need a more robust prophylaxis to get them through that time frame where they're practicing, they're participating in games. Perhaps there's a tournament on the weekend, so you have to have some ability to set up a prophylaxis, almost like an individualized prophylaxis for that one patient. So what we want to do is, I know that for women with heavy menstrual bleeding, there are different therapies that can be used. So one of the things we're trying to put forth here at Octapharma is that when you lose blood, you are also losing iron. And the development of iron deficiency is quite the terrible disease, because iron is kind of critical to make hemoglobin, which carries oxygen from your lungs to your body. It's critical to make myoglobin, which is the kind of cousin of hemoglobin that's in muscle cells and stores oxygen for those muscle cells. It is important for these enzymes to allow your mitochondria to make energy. So iron deficiency can cause a lot of problems. And I'm not talking about iron deficiency anemia, but by that time it's too late. We're talking about folks with iron deficiency. So here we have a female with heavy menstrual bleeding, and let's just assume she's on a hormonal therapy with or without tranexamic acid. But those two therapies are not either preventing her from developing iron deficiency, or they're not resolving her iron deficiency, in addition to receiving some form of iron, then she's not really getting most of the benefit from her therapy. And that perhaps the development of iron deficiency, or the inability to resolve her iron deficiency, requires a rethinking of this clinical problem. And perhaps this is a woman with heavy menstrual bleeding who actually needs factor therapy, and to halt her excessive menstrual bleeding, to prevent blood loss from occurring, to then prevent her from developing, or at least resolving, her iron deficiency. So that's how we're going to put both of these topics together. And I think they go very well hand in hand, because if we look at males with severe hemophilia, the majority of their bleeding is internally. So they have the luxury of having their iron recycling plant kick in, and they recycle their iron. If we look at females with hemophilia, they tend to bleed outside the body, so they're losing blood. So we want then to not allow them to develop iron deficiency, and if they already are iron deficient, to resolve their iron deficiency.
That's amazing. I think we've heard some about how iron plays a role in some of these things, but to be able to get into the intricacies of it, I think is super important. And like you said, it kind of could be almost like a leading indicator to the need for treatment, right?
Oh, absolutely. Absolutely. And I think, Jonathan, I think you and I have spoken about this before. One of the most terrible symptoms of iron deficiency is fatigue.
Mm,
You and I can go on a long walk after having a nice dinner, and we'll be a little bit tired at the end of the walk. We'll go into our homes and we'll be fine. Fatigue is, my goodness, I can't get out of bed. I don't have the energy to dress my kids, to dress myself, to think about what am I going to do for the day. And so
mhm,
that's not tired. Tired is a physical symptom. Fatigue is a combination of mental and physical. And
mhm.
and and when your mitochondria aren't working, when they're not producing the energy that's required, because all those enzymes that make our energy are lacking the gas in the form of iron, well, that's problematic.
Mm. So powerful. Another one of the issues that you're talking about, not just for, I think that there's sort of this standard cookie cutter, you know, male severe type person that's living with hemophilia. But the more that we learn and the more that we discover, we realize that, man, there's so many variations of hemophilia out there. So, we've talked about this, especially with women with bleeding disorders or people with quote unquote mild hemophilia. A lot of times they're getting diagnosis, but they're not getting prophylactic treatment or preventative treatment regimens recommended. And so I know that that's something that we're all trying to hopefully move the needle on to see people get to a place where they can have, a better quality of life. But that's another topic you're going to be covering at this event as well. As you're going to be talking about prophylaxis for all different types of hemophilia, not just the standard, a cookie cutter person that's severe A male. You're going to be covering about how prophylaxis could benefit really people with all different kinds, right?
That is correct. And again, we have this kind of way of characterizing patients based on their factor levels. But like for instance, we know that women with hemophilia will bleed at any level they want to. They can have a level that falls within the normal range. They can have a level that falls below the normal range or reference range, and they can bleed. You can have a boy with a mild phenotype based on his factor VIII activity level who bleeds a little bit more as if he has moderate or severe hemophilia, or a boy with moderate hemophilia who bleeds like as if he has more like severe hemophilia. So I think that we kind of, you have to kind of expand your mind and say, I'm not treating a number, in other words, a factor activity level, but I need to treat the patient, and perhaps this patient bleeding history is more important than his factor activity levels, and I need to treat that, because can't have people develop bleeding into their joints, because that sets off this horrific chain reaction of inflammation, destruction, more bleeding, more inflammation, more destruction, and then you have problems when you're in your 30s and 40s trying to get around.
Yeah, we've seen this happen throughout the community where we have women who were told that they were just maybe a carrier, or they were just somebody that had hemophilia in their family, but they didn't have it. And a lot of times we've seen some of them now get to the point where they're aging at 30, 35 years old because of whatever has been going on in their joints. They're now having to have knee replacements, or they're having to have limited activity because they have all this inflammation and arthritis. And I think that there's a lot of misdiagnosis, and really, I believe that that's attributed to the fact that we're just continually learning. I know that can be sometimes a very hurtful thing sometimes when you feel like you're
Right.
not being paid attention to. But honestly, we're all learning and we're trying to understand. Oh my gosh, one of the things that was a big revelation to me, and I know you and I've talked about this a bunch, is that the range is basically 0 to 200%, if you will. There's some disagreement about, is it 170 or 200 or whatever, but truly it can actually even go higher than that. Really, the issue is that some people may need a higher level to have optimal outcomes, right?
Absolutely. I think we talked about this during dinner the last time you
Mhm.
and I sat down to break bread, and we talked about, well, there's a reference range, and that reference range may go from 150 to, let's say, 200. Well, why is that? Why is it that you know I live pretty good at 80, but another person needs to live pretty good at 120 or
Right, factor level,
150,
right,
right? So
right.
so so why do they need 150 and I only need 80? So the
Mhm.
same may be thought about in a person who has hemophilia, using a correction to 80 or 90 or 100%. Well, that might be good for the general, kind of taking the dart and throwing it at the dartboard, but it might not be good for that one patient who really needs to live at about 120 to 140.
Right.
And everyone's metabolism is different. When they talk about pharmacokinetics, they're not talking about the drug. They're talking about the 10, 15, 20 folks who are on that phase one trial who had pharmacokinetics, and they all fell kind of, in the middle. And there was a range between 20 and 45, and the median was 35. So you have to just be very, very careful when someone is talking to you, and you need to truly understand what do they mean by half-life, what do they mean by this, that, and the other thing. So, and here's what we need to have, really astute healthcare providers who are listening. And sometimes it's difficult to listen, Jonathan.
So
You
true.
know, we get home from a busy day and our children want this, that, and the other thing. And if you have 5 kids like me, and little kids running around, it's hard to listen to each one of their, hey, Papa, I want to tell you this, or hey, Papa, let's go outside and play that. So you really have to sit down, and I really sometimes have to tell them, listen, I'm listening to Nora now. I'll get to you, Freddie, then Lulu, then Alex. Paulie's just only 13 months, so he just goes da, da. And that's his all-encompassing hello, goodbye, leave me alone. But so we have to sit down and listen. And if our patients are not doing well at 100%, well, that's why a reference range is between 50 and 150. Perhaps
Right.
they need to live a little bit higher. Now, is there anything in a medical textbook that tells you that? I don't think so, Jonathan. So that's why there are certain things that we develop skills as physicians, as healthcare providers, as we go along. And we are also continuously learning. There really are two oaths that physicians take. One is the so-called Hippocratic oath, first do no harm, which is nice. You don't want to do harm. But there's also something known as Maimonides' prayer. And that's, I think, is more critical, because that says, this prayer says that we always continuously have to learn. Just because I'm sure about something today, that may not be true tomorrow. Something new in knowledge may change a preconceived notion. So this continual learning, continual listening, and we feel, and again, that's why a reference range is wide. If we didn't need so many wide reference range, well, then everyone would have 100%, wouldn't they?
Right.
But we don't. Well, some guys some folks have 50, some other folks have 150.
Mm-hmm.
Why is that?
Mm-hmm.
And perhaps it's because that's where they live comfortably.
Well, I think it's an important conversation for us to be having. And I also think it's important for us to be thinking about, because I find, a lot of people know I have severe hemophilia myself, and have struggled with keeping my levels, where I want them to be. But I've learned so much, even in just the last 5 years. One of the things I just recently went through was having my correction to 100%. Previously, I was at 60 or 70% regularly for my prophylactic dose. My doctor came to me and said, "Look, I really think you need to consider we can do better. Let's do 100%." But then I have, my daughters who also are affected, that have a low level, and they have been struggling to get any preventative treatment. And of course, we've advocated for that and pursuing that. But the bottom line is that, there doesn't seem to be this urgency to try to get them to 100% correction. And there's a satisfaction, if you will, I think in medicine in general, to just say, well, if you're a female with a bleeding disorder, that maybe 49% is acceptable, maybe 30% is acceptable. But in reality, we wouldn't say that even to me. We would say, no, we need you to be at 100%.
Right.
And so I think it's just somewhat of it's a learning. I love what you said about those people who are listening, even physicians who are listening. There are some who are really listening. And I do believe that it's so important. As patients, we can also influence those decision-making things that happen between us and our physician. One of the most sacred relationships that we want to protect is that doctor-patient relationship, that there's a partnership that happens in making shared decision-making. And unfortunately, I think a lot of times, if we came more prepared to that conversation as a patient, there would be potentially a leaning towards, okay, we want to make something that's a lasting impact that really will help you for your whole life, not just. That's one of the things I love about your title for this session about prophylaxis. It says zero bleeds for everyone. And, I think a lot of times we've gotten stuck on, I've talked about this a lot. I talked about this at our joint health conference about why is it that we start referencing ABR? I mean, like in the last 15 years, annual bleed rate has been largely one of the biggest conversations in the communities. ABR. But if you talk to and interview 20 patients, all different severity levels, and you ask them, what is a bleed? They have a different way of communicating about what that is for each and every one of them, because it feels
Mhm.
differently in the body. And so we keep analyzing our success based upon whatever they reported in their annual visit. But a lot of times, what Johnny reports and what Sandy reports and what Lulu reports and what everyone else reports, they're all maybe slightly different. They may say, well, I didn't really have any bleeds, but I had inflammation, I had soreness, I had heat, I had limited motion. You're like,
Right.
well, that's a bleed. And they're like, yeah, but I didn't really have a full blown,
Sure, sure. And it may be like, so for instance, if little Johnny gets his factor eight on Monday and he has this tingling and other symptoms, let's say Tuesday evening going into Wednesday, well,
right,
perhaps his factor eight activity is declining. And again, if he's the type of boy who needs to live at 120, maybe 30 just ain't good for him. It just
right,
ain't,
right,
you know? Whereas another boy has no issues, no tingling, and maybe 40 is good for him. He's just one of these boys who, for 40, that's just the way my genetics are. My vascular system is different than yours, and I can do well at 40 or 50. And then also the folks who do well at the other end of the spectrum of
right,
this reference range, because the reference range is wide, you
right.
know?
Well, we have guys, and when we're starting to see this now with gene therapy, we have guys now floating around 17%, and they report not having a lot of bleeds. They report, feeling pretty good for their general day to day, lifestyle. And it's interesting because, again, I think the goal is exactly what you said in the title of the session, which is zero bleeds for everyone. The number can change. It can look different for different folks, but at the end of the day, is it really truly zero? And that's the goal. It is attainable today. I just think we have to have the right information, and we have to have the right partnerships, and we have to have the right tools in our hands so that we know how to advocate for that for ourselves and for our children. Because I think even me as a parent, I mean, you're told a couple times that, oh, well, they really are just a carrier. They can't really have symptoms. And so you start to really believe that. But then you see in real life something different, and that becomes a conflict that you have to either resolve or ignore. And I think so many of us are finally coming alive to the idea that maybe there's benefit in us having to advocate for ourselves and pushing the envelope to say, we need better. We need zero. We don't just need one ABR, two ABR, three ABRs acceptable. We need zero.
Right. And we that term carrier, well, they're a carrier until they're not a carrier, you know. And I was taught, going now back to iron deficiency, that there's a cause for
Mm,
iron deficiency. Your diet doesn't have enough iron, your gastrointestinal tract is not absorbing iron, or you're losing blood. That's really basically it. There's also a cause for bleeding, Got a
mhm.
basketball to the face, your vasculature is not doing well, you have missing proteins or missing platelets, or you unfortunately may have a cancer. I mean, so there has to be, you just don't bleed. No one just bleeds. There really is a cause. So if a young lady is, dad has hemophilia, well, she's not falling far from that genetic tree. She has hemophilia. If her dad requires a factor eight activity level of 120%, well, she ain't falling too far from that genetic tree. So I think that we need to kind of think about that. And as well as I do, Jonathan, sometimes the 1 + 1 = 2 may work for 40% of the folks, but there are folks where 1 + 1 has to equal 3, or 1 + 1 has to equal 4. There's a song by Radiohead that's 2 + 2 = 5. Well, maybe in some situations 2 + 2 does have to equal 5, because we have to think about it. And I think that physicians and other healthcare providers have to have the creativity to kind of sit down and say, okay, you know what, this is not working. Let's increase the dose. So give me a call in 2 weeks. Tell me how you're doing. I don't think you need to wait months and months on end to where you both have forgotten what you talked about, but you can
Right.
make a therapy change and follow up quickly on that therapy change.
Hmm. That's
And
so good. I learn more at these events that we do. Like we're coming up with Profi Conference here in May 22nd and 23rd. I learn as much from the question and answer times as I do from the present. You always do such a thorough job at the presentation and the slides and all that stuff. It's so wonderful. But I actually really love that interactive portion too, where you're answering questions. And so I would just say if you're listening to this podcast today and you have questions for Dr. Claudio, you can put them in the chat for sure, even now and in the comments. But I would encourage you to register for this event. Come hang out with us because Dr. Claudio, you're always so willing to answer questions, and I always appreciate your listening and also providing that creative feedback. But thank you so much for being with me
my
today. Thanks for
pleasure.
being a part of this event. Thank you so
Absolutely.
much for all that you do every day, and we really appreciate you. And we'll see you very soon.
Likewise. Until the next time we share a meal, Jonathan, okay?
All right, man. Take
Take
care.
care.
All
Bye.
right. Well, I am so, so excited about this event. And once again, I want to say a big thank you to Dr. Claudio, who is just such a hero of mine. He's just a joy to spend time with. And as you know, he is very concerned about making certain that people are really doing all that they can to live their best life. And so it's wonderful to have an expert like him in your corner. And while living with bleeding disorder, I always feel inspired and like I could champion anything after I go to a time to be able to spend with him. So please come hang out with us Wednesday, 22nd, 1 o'clock and 2 p.m. Central Standard Time. He'll be doing his two presentations, one on iron deficiency, another one on zero bleeds for everyone, which I'm really excited about. You can go right to our website at hope-charities.org and you can register right there on the homepage, or you can even click this little QR code and it'll take you straight to the website so that you can register for that event. But the event is going to be a 2-day event, 22nd and 23rd. It's going to be full of great presentations. You can listen right from your cell phone, log into Zoom. We'll send you all the links you need. All you have to do is register once. We'll send you all the information for all of the sessions. But thank you so much for spending your time with me and Dr. Claudio today to learn more about living with bleeding disorders and the importance it is to advocate for yourself. We at Hope really believe that the most important thing is that you are educated, empowered, so that you can have choice for your product and your service, and you know that you are in the driver's seat. And so I really appreciate you taking the time to listen today and participate with us. We're going to be doing a lot of prizes and giveaways at this event. We love to have fun, and generosity is our middle name. So we love to do that wherever we can. So come hang out with us. Register right now on the website. We would love to see you very soon. And we hope you're having a great evening, and we'll talk to you then.